Hi, and welcome to the award-winning Ed Brown Show. I'm your host, Kamaria Richmond, and we have a wonderful show for you today. We are talking to Dr. Jasmine Bradley, and she's a chiropractor. And I'm really interested, we were talking before the show about bones cracking. So we're going to get some more details. Dr. Bradley, welcome to the Ed Brown Show.
Thank you for having me. I really appreciate it, Ms. Richmond.
Yes. So I wanted to start with, what do you need to know about being a chiropractor?
Okay, so chiropractic, every time I start in school and things of that sort.
Yeah.
So I'm a graduate from Palmer College of Chiropractic in Port Orange, Florida. And the program is a 4-year program. So you go and you do your undergraduate. If you choose to do grad studies, you can. But then the chiropractic program is a 4-year program. And my program, they taught us how to assess the spine, the neurological system, and the muscles, because the spine does contribute to dealing with the nervous system, and it's all a big segment. It's all a part. It's integral. So people don't really know that. They just think, oh, you're going to contact my bone and pop it into place. You're going to crack my neck, but there's more to it than that.
Right. And what are you specializing in, something in particular, or just general practice?
I'm just a general chiropractor.
Okay.
So I'm not a pediatric chiropractor or like a sports chiropractor. I do it all. I see all kinds of patients. So we do have pediatrics, we have geriatrics, we have athletes, we have motor vehicle patients, we have workers' comp, so just all types of patients come in.
Okay. And now what are the top 3 things that people come see you for?
Lower back pain, neck pain, and now what I'm really getting is a lot of shoulders. Getting a lot of shoulder issues now. Those are my top 3 right now.
And okay, so tell us how you treat each of those.
So each patient, the process is pretty much the same. So they're going to complete the intake packet. Preferably they do it before they come in. Do the intake packet, and then I will review the information, bring the patient back, we'll do a history, and then also we will do an assessment of the region. So whether it's the neck, the back, or the shoulder, the ankle, whatever the region is, and we do a nice exam, very complete, thorough exam. We will take it through different ranges of motion. We'll do a few orthopedic tests to see if we can reproduce the pain or the discomfort. Then after that, depending, we will adjust. Usually we do adjust. If not, I will send the patient for imaging.
And what kind of test are you doing? So are you looking digitally, or how do you find out where the exact pain is? I guess your diagnostic testing.
The process, got it. So actually with that one is, most of that's going to come from the patient. So you're going to listen to the patient, find out where they're pointing to, and then you know the muscles, the joints, and the regions that are involved. So you're thinking in your head while you're speaking with your patient differentials. Like, what could be going on in this region? Was it a trauma? Did they say, I just woke up this way? And with that point, after that, you're going to do your assessment, so visual, and then you're going to watch them do the range of motion, have them do different things to see what is actually involved in the region. And then after that, you'll do, we call an orthopedic test. So with that one, you're trying to do various motions to see if you can reproduce the pain, and that will lead you to the joint or the tissue, and then you say, okay, I know you have frozen shoulder or adhesive capsulitis or a sprained strain of the neck, whatever it may be.
And so we were talking before, I was talking about, the cracking of the cracking of the bones. So, and you were saying you have different types of techniques where you don't have to do all of that. So tell us about that.
Yeah, Ms. Richmond, she's not a fan of that. So there are various types of chiropractic adjustments. So for patients that do not want to hear the cracking or the popping be manipulated, brought to different ranges of motion. The cracking is called cavitation. It's just air escaping the joint. You can do Thompson drop. So that one, it can be in high-low table, so the table actually raises up, and you can lower it back down. And then you're going to set it to the weight of whatever segment you're going to adjust. contact it, and then you just drop. So the patient doesn't hear that. They'll feel it, but it's a pretty gentle adjustment. Another one is activator. So it's a handheld tool that you use, and you start from the feet and you work your way up. That one the patient is not going to hear or feel like any kind of movement with that one. But there's so many different techniques. You don't have to do a diversified adjustment, so don't force your patients to do that if they don't like it. So do something else.
Do something else, right?
Do something else. You learn a bunch of techniques.
I want something else.
It's no problem. It's no problem.
And then what do people ask you the most?
Okay. So which one? What do you mean?
Do they ask you more about the techniques, or do they ask you, okay, how long do I have to come? How many sessions do I need?
Absolutely. So yes, they do actually ask me both of those. So people want to know, how much is it going to cost? How long is it going to take? And can you fix me?
Yes.
That's the main things. So I said, I'm going to try. So each patient is different. So depending on what it is, so whether it's a car accident patient or just a wellness patient, someone saying, I really have no pain, I just want to be checked out. So that's a totally different thing there. And then sprained strains or like muscle injuries at the gym, we get a lot of that. Or parents running after their toddlers. I had another, she's like, oh, my back. I was chasing my little girl. She was riding her bike and I pulled something. So it didn't really take her long at all. But usually starting out with health insurance patients, I try to see them at least twice a week.
Okay.
Initially, and then once they start to make some progress and we add some rehab exercises once a week, every other week, and then as needed. So that's usually my general protocol, but some of them, they do much better before that, and we just do it as needed. Car accidents and workers' comp, you're going to see them more frequently. So at least maybe 3 times a week for them, and then you do a re-exam. I like to do them within a month. That way I can compare and see how they've made progress, and if I'm going to keep them or release them. That's how that goes.
And what about the insurance? Now, insurance is a really, that's a really big thing for when you're having to go through, like if I need to see you 3 times a week or, every 6 months. So what about the insurance? How does that
factor in?
Yeah, factor in.
Absolutely. So with insurance, the patient, so prior to treating them, we like to get their benefits verified prior to coming in. And that way they'll know what their copay is, how many visits, chiropractic visits they're allowed per year or per condition. And then also if physical therapy or modalities are covered. So modalities are like the stem, the heat, soft tissue techniques, and things that sort, exercise. So we'll let them know. And we're mindful. We're mindful of that, and I can always call and request more visits if needed.
Okay. Yeah. And now, do you work with any other specialists or any other doctors? So if I see you and you find something that's different with another joint, like do you
referrals? Yes.
Referral to like a we were talking about that before.
Orthopedic. To medical doctor. Yes, absolutely. So other things too, a lot of people may not know, but chiropractors are also considered to be like a gateway type doctor because you see your chiropractor more frequently. Okay. And then once you start to improve, people are like, I'm feeling so much better. But you learn more about your patient and say, hey, you really need to send you to your primary care and get them to check out what's going on with that. Or let's send you to an orthopedist. So usually we'll send them to an orthopedist if there's a fracture. Something like that. That is something chiropractors do not do. If it's a hypermobile joint, do not thrust into it. Do not. Do not. You need to go to the orthopedist. So, you'd be surprised. You do get patients that come in with fractures. That has happened to me before. Okay. And so I had to tell them, I said, wow, well, I can't help you right now. I need to get you to an orthopedist, but after, I'd love to treat you, but you have to get that. We have to get that taken care of first. Okay.
And what about any other conditions besides, if you need to see someone like a foot doctor or whatever? But what do you work with any other, instead of like just your primary care, but do you have a connection with any other doctor?
So it depends because At my office, I'm also trained to do rehab physical therapy as well.
Okay.
So I don't have to refer to a PT because I am trained to do that and licensed. So I have that as well. Mine is more so maybe if they do need to see their primary care for medication or something like that. I'm one of the chiropractors that's not opposed to that. I think we can all hold hands, you know. So I'm glad that we're starting to see that more so as what's going on in healthcare too. Because prior to that, you know, you did have medical doctors who did not want to refer to chiropractors, you know, thinking that chiropractic didn't help because it is a complementary and alternative type of treatment. But a lot of people are benefiting because people want to continue with the holistic approach. Everybody doesn't want to pop a pill. And they're saying that it's just masking, it's not really solving it. So, but I do believe that we can hold hands. Some things chiropractic can really help for, and other things it may not be so helpful. So just find the right combination, the right team, and we can all do our best to do our due diligence to help the patient.
Right.
Yeah.
And that's a big thing with healthcare because, you know, I may need to see you and a couple doctors after that, depending on my condition.
Exactly.
Yeah, and so you want to know, like, who's the best for that person and who covers your insurance.
Yes.
That's a really big thing. And you mentioned something that I wanted to ask you about was holistic, whether it's holistic medicine or treatments. How do you feel about that?
I think it's great. That is my field that I'm in. So, so holistic medicine, like I said, I think many people can benefit from it. So just depending on what your patient is presenting for. So like I said, if it was a fracture, you tell them no. We need to refer you to the orthopedist. Also, if it's no fracture, if it was just a car accident, they woke up, they couldn't turn their neck, you can definitely do some complementary alternative type medicines. Chiropractic is a great technique. So you can offer them various modalities as well to loosen the segments before you go thrusting into the joint, or if we're going to do, you know, treat her, we wouldn't go thrusting in that way because you don't want to hear the cracking sound. So we would do another type of treatment, so probably the drop or activator, something like that, and do some soft tissue work to loosen the segments. And that way you have better range of motion, things of that sort.
So what do you think about yoga? I mean, we know that yoga is good for you, but do you like suggest to your clients, so when it comes to holistic treatments, what do you actually suggest to your clients?
So like in addition to the chiropractic, I think yoga is fantastic. So the only thing is, because people think, oh, I can't get injured doing my yoga stretch. That's not true. So you want to make sure that you do have the proper technique and that you are being very careful with it, and that your biomechanics are in proper line, because a lot of people do injure themselves with that too. I have gotten a few people that have sprained muscles in the back, also disc herniations, you know, turning too quickly and throwing themselves. So you want to be careful with certain moves. But yoga is a great treatment if they want to consider that, or still if they work out at the gym, they're doing stretching. I have people doing CrossFit, so many things people are adding to it as well. So I think yoga is a great technique. They want to do that as well.
And people have to start with beginner yoga.
A lot of people say, yeah, I would definitely start with the beginner. I would do that. Unless you're an athlete, you know, because athletes are a completely different ball game. So with them, I try to dial it back a little bit, because when you're treating an athlete, they're different from your everyday patient. So they're like, oh, okay, you tell me to do this, I'm going to do more. And so, no, that's not what I told you. Like, I asked you to roll this region for 30 seconds. They're like, oh, I did it for 30 minutes. I said, oh, God, you know, that's too much. So it just depends on the patient you're treating and then who you're providing the care for. So you kind of want to gauge it.
Okay, and what about Pilates?
Pilates are great too. I have patients that do that. Even at the old office where I was, I had a few people that did that. They have really great results paired with the chiropractic. So yes.
And what do you think about using acupuncture, acupressure, or just working on those like really soft points? And
I think those are also great forms of like complementary alternative medicines too. Chiropractors, some of them are licensed to do acupuncture. Another thing that some chiropractors are learning and taking on is dry needling. So that one is a bit different than acupuncture. They still both use those hollow point needles, but the thing is acupuncture's focus on meridians, and so dry needling is more on the muscle. So it's going to pierce deep through the muscle belly to work on relieving the pain. So you do have to do a few sessions with that too.
No, it's the pain level. You know, for me, what is the pain level?
Pain level. Okay, so that is a great question. But it depends on your patient, because some people do have like a high
tolerance.
Yes, ma'am. Right. So, and some people, they can't do anything. So if you put a little pressure, like, it hurts. I'm like, I'm sorry, I have to do something. I can't just like leave this muscle. I can't just not do anything. But they're like, okay, whatever you have to do, Dr. B, it's okay. But some people are like, yeah, you can dig in there. And they're like, just go ahead, go for it. I'm like, okay, it's up to you. But it depends on the patient. Each person has a different like pain threshold. So when I'm treating the patient, I try to be mindful of that. And I don't want to do anything that's going to hurt them. Only something that's going to help make them better. But it's not no pain, no gain. That's not the kind of thing.
Right.
So it's not beat up your patient. So I don't do that. I try to be mindful of them.
And speaking of being mindful,
yes.
Do you teach your clients mindfulness in some sort of form?
Absolutely. I'm a big advocate of patient education. I think that patients should know what's going on with their bodies. I do like to explain things. I want to show them the exercises. I want them to show it to me. I want to make sure they're incorporating it at home as well. Because the main thing is, you want to get the patients back to their regular everyday life. You know, so I want them to continue to do the certain tasks they were doing. So I want to hear progress. Like I had one lady, she came in and she says, I want to go hand dancing again. My back hurts and I couldn't do it. And she said, I said, okay, well, what's going on? Where were you having the pain? She's like, in my back. She said, you know, when they dip you back, and then she said, well, wait, I can do it now. I said, that's what I'm talking about. That's awesome. But she said, before when she was brought back into extension, so that's bending back, that's where the pain was, and she couldn't do that. So I said, I want you to go hand dancing, and I want you to tell me about it. Let me know how you felt. Like, did you feel the pain? Was it great? Were you able to bend further back? You know, were you able to bring your arm up with it? Tell me what was going on. So I love to hear like these great stories.
And what do you tell? So what are like the top 10 things that we should do every day to keep our body in alignment?
Oh, that's wonderful. So let me see. Well, one, you definitely need to get plenty of rest.
Okay.
You need to drink plenty of water too, because a lot of things too is people don't realize when you see your chiropractor or you go get a massage is another one that's really good, or when you get your acupuncture, acupressure, whatever it is you're doing, you have to rehydrate the body, because most of our body is composed of water. And so you have those discs and they reabsorb. That's why when you're sleeping, the body is reabsorbing all those materials, allowing for the disc to come back in the spine. So because every day, throughout the day, we're having the compression, the axial load on the body, pushing the materials out from the disc, and you kind of crouch forward, you notice that.
Right.
But you want to rehydrate the body, you want to stretch, you want to have a proper diet. So you want to have more greens and lots of proteins and things of that sort. Well, depending on what your dietary needs are too. You want to avoid like lots of sugary things, because that promotes inflammation, which also causes pain. And yes, it's a big thing that causes pain and the discomfort in the joints too. You want to make sure that you're getting your exercise in, do your stretches. Also, you want to just take care of your body, you know? You want to have good thoughts too, because that is another component of things, how they manifest in the body. Thoughts, traumas, toxins, these are all things we put in, things we say, things we do, injuries to our body. These all manifest. Other things you want to do too is you also want to make sure that, you know, you're taking good time for yourself, taking care of your body. It's a main factor there too. So do your exercises, continue to get your adjustments, then as needed. It's just like someone going to get their car repaired.
Mm-hmm.
You know, you have to make sure you have all these fluids and things to keep your vehicle running, so your spine and your body's no different. So that's the thing.
Yeah, and those, I mean, you have quite a few key points with the diet. With the diet and the exercise. And what is the biggest one out of all of those that we know that we must do every day?
I would still say, like, you have to treat your body like how you would do any other thing that you value. Mm-hmm. That's the main thing, because I know a lot of people come in and they talk about their diet. You know, I have to run, I have to get the kids, I didn't have time to do that.
Right.
And so the thing is, too, like, whether it's weight loss, you know, 80% is diet, and the other part is exercise. This also makes sure that you're able to maintain and keep your adjustments. So a lot of rest, you have to get plenty of rest. I had this one patient, he only sleeps for like 3 hours. I said, how are you doing this? Because you're not able to function, you don't have mental clarity, you know, you're just compressed, just going through the day and not even fully there, not cognizant. So I would say those are the main things. And if you're gonna do a workout or routine, you wanna stretch before and then stretch after, and drink plenty of water. So those are the main things. Those are really important.
And the one thing I wanted to ask you, and this is from like back in the 90s.
Okay.
I was looking at, is it Rolfing or Ralphing? It's been so long I can't even remember.
Okay.
Where they just kind of, I don't even know how they did it, just so that your body is in perfect alignment.
Are you talking about Reiki?
No, not Reiki, but like I said, it was in the 90s.
Okay.
And it was like Rolfing, I think.
That one I'm not familiar with.
Okay. It was and I was checking out how to do it because I wanted my body in like perfect alignment. But I haven't seen or heard anything about it in like, I guess, 20, 30 years.
It probably was like a fad thing. You know, they always adding new techniques, new things, so somebody's probably still doing it. I know you have people that are doing Reiki. You have people that are big on essential oils. So it depends on the kind of chiropractor you are and where you're going. You have some who are big on supplements, talking nutrition with you and making sure that everything is balanced. So it depends on who you're going to see. You have some that are big on like exercising, rehab, weight loss, things of that sort. And you have some that just want to, like you said, just crack you, get you in and out. And you have some that just do like a comprehensive type thing, just a bit of everything.
And when it comes to, you know, Eastern or Western medicine, do you offer your patients, I guess not referrals, but like places to go? You know, if you do want to have some Reiki, this is the person.
Absolutely.
Okay.
Absolutely. And same for massage, because chiropractors, we don't massage, we adjust. But we do, some of us do soft tissue techniques, and there are various ones that you can do for that, but it's not like you're going to get a massage. You're going to get adjusted here. So, but definitely I do referrals for things like that.
And how long should we have our adjustments done, or how long? So do I need to see you like once a year to get adjusted, or every 6 months?
So it depends on the patient. Starting out, like I said, initially you treat your patient more frequently, and then you space out the visits when there's progress.
Okay.
And also during that time, you're teaching them how to take care of their body, so how to rehab, strengthen, maintain, and keep their adjustment. And then I did have one patient, I saw him probably twice a year. That was maybe about 2 years ago. He would just come in every blue moon, and he's like, yeah, I was feeling great. I said, wow, every time I see you, it's a new exam. You know, so like, but you look really good. He says, yeah, I feel pretty good. I just came in for you to check me out. So it depends on the patient.
Okay.
But you don't need to see them like 5 days a week, you know, like forever. Don't do that. That's too much. You know, you don't want to do that. So you got to let the body heal, help the patient to focus and process what's going on, work on strengthening the body and things of that sort. Because you do have those ligaments, you don't want it to be hypermobile. And then, so that's like too much. So ligament laxity, things of that sort, you don't adjust into a hypermobile segment. So it's like the disc, the joint, the bone, the muscle. If it's hypermobile, don't touch it.
Right.
If it's hypo, so it's not moving, then that's okay. You can feel the fixation restrictions, and you go through and you do that. You can adjust.
And if you want, like, you want that straight up and down spine,
Yes.
what do I have to do to have that spine just straight up?
That one, so that's, if you do a spinal screening, you're going to assess the patient from the head down to the toe. So
Okay.
that one, you want to make sure that the chin is brought back, so the ear should line up with the shoulder, the opening of the ear. So like we see a lot of people going forward, anterior head carriage. So this is
Right.
actually putting more poundage, more strain on the body. So this is also making it difficult to breathe, adding more pressure because the weight of the head is just a strain. Also more tension going down the mid-back. So you want to teach them chin tucks to bring that in. Hold it for a few seconds. So the ear should
Interesting.
line up with the shoulder, and when they're standing, you want to make sure that the hips aren't rocked forward. So that's the ladies or even some guys that have like the larger back sides. They have an increased curve of the lumbar spine, the lower back, so we call it hyperlordosis. So we want to try to retrain them because the hips shouldn't rock forward. That's putting more pressure on the back.
Okay.
You know, the knees. So just watching the plumb line and just looking at the patient, like how they move, biomechanics, how are their feet? Do they have flat feet? Do they have high arches? You know, do they have a knee that kind of pops backward? Things like that. Do they have scoliosis? You know, is it a structural scoliosis? That's one that stays. If it's a functional one, one that, you know, is still because the muscles are tight. But structural is usually saying that there is an abnormality of the spine, like a bone that's additional, or like there's another piece on it or something like that. And that one is one that stays. So they would have like a little curve or something like that. But you can work on giving them some relief with adjusting the segments and also relaxing the soft tissues. Because you'll see, like have a high shoulder, high hip.
Right.
So it's rounded, things of that sort.
Okay. And let us know how people can reach you, how they can contact you.
Oh, awesome. So we can be reached at alignedchiropracticdc.com. You can also find us on ZocDoc.com. The name of the office is Aligned Chiropractic, and we're located in Glendale, Maryland. And you can find us on Instagram.
Great. Yeah,
Yes.
we're going to get you on that social media.
Yes, I told her I'm not really that good at social media, so the patients are telling me, Dr. B, you got to get on here. I said, I know, I need help.
Well, I want to thank you, Dr.
thank
Jasmine
you.
Bradley, for being on the award-winning Ed Brown Show. And thanks everyone for tuning in, and we'll see you next time.
Thank you, it was a pleasure.